The National Institute of Occupational Safety and Health defines carpal tunnel syndrome as having two or more of the following criteria. One or more of the following symptoms affecting at least part of the nerve distribution of the hand. Again, the median nerve comes from the neck, goes down the arm, through the carpal tunnel, and supplies sensation to the thumb, index, long, and half of the ring finger. So if you have either paresthesia, which means it just doesn't feel quite right, it's a little less sensitive than normal, hyperesthesia, which means it feels super sensitive, pain, or numbness, then that is criteria number one being met for carpal tunnel syndrome. So if you have one of those symptoms plus one of the signs, which means a physical exam finding that we're about to talk about, then you, by definition, have carpal tunnel syndrome. So let's talk about the signs. So if you have a positive Tinel sign, a positive Phelan test result, or diminished sensation to pinprick in the median nerve distribution, that's considered a positive sign on physical exam. Now let's go through each of those tests. Positive Tinel test means that when you tap above this crease, this is called the distal wrist flexion crease, okay? When you tap right above that crease and you feel shocking sensation going into these fingers, that's carpal tunnel syndrome. The Phelan test consists of putting your arms in a bent up position. A lot of times we'll rest it on a table, putting the backs of the hands together and fully flexing the wrist. A positive test means you get numbness or tingling in that distribution of the median nerve. Sometimes the test takes up to a minute to become positive, but if it's positive, that's considered a positive finding. So I'm starting to get numbness and tingling right now because I have carpal tunnel syndrome. So I'm going to shake them awake, and I'm good to go on. Now, pinprick, that's pretty obvious. If you compare the two sides, you take a little pin and you compare the two sides, then that's, if it's diminished on your normal hand, on your bad hand, then that's considered a positive sign. So that's really all it takes, according to the National Institute of Occupational Safety and Health. Positive symptoms and a positive sign. Thanks.